Hi, my name is Shauna. Today I'm going to show you how to properly do an abdominal assessment. First, you do need to check your patient's medical record and check for any PPE requirements that you may need. You should have already gathered all your necessary supplies. Make sure you're organized, ready to go, and that all your equipment and supplies are clean. Now, once I enter the patient's room, I will go ahead and introduce myself. I will identify the patient with 2 patient identifiers and explain the procedure. So, entering the patient's room, knock, knock, knock. Hi, my name is Shauna. I'm your nurse today. How are you?
Good.
Good. Could you please tell me your full name and date of birth?
Aaliyah Hatchet, February 2nd, 2009.
Very good. And I'm going to go ahead and check her wristband just to make sure that everything matches up. And yes, it does. So, Aaliyah, as I said, my name is Shauna, and I'm going to do a quick abdominal assessment on you today. I'm just going to be listening and feeling to your, right here in your abdomen, okay? All right. So now I would be sure to go ahead and do hand hygiene. Get that. Today I just have some hand sanitizer, so I'm going to go ahead and make sure that is all rubbed in real well. I'm going to go ahead and clean my stethoscope. I have already closed the door for privacy. I have also closed the curtain if we would have one. We'll have the curtain closed also for privacy. And at this point, I would go ahead and put a gown on the patient if it would be indicated. But today we're just going to go ahead and use this blanket. Now, before anything, I'm going to have Aaliyah lay down because doing an abdominal assessment properly, they need to be in the supine position. So Aaliyah, if you don't mind, I'm going to have you go ahead and lay down. And that, yes, very good. I'm going to cover you with a blanket for privacy. Okay. And I would also, if I could, would raise the bed to a better working height so I won't injure my back. And now I can go ahead and start the abdominal assessment. I just want you to know with abdominal assessment, you need to go in the order of inspection, auscultation, percussion, and palpation. Now today I will not be performing percussion, but I will be doing the other 3. But it is very important that you go in that particular order when you're assessing the abdominal region. So Aaliyah, I'm just going to lower the blanket here, and I would raise your shirt up because first I'm going to start with inspection. I would inspect the contour of your abdomen, and looking here I see that the contour is flat, the abdomen is symmetrical, the skin of your abdomen is congruent to race. I don't see any lesions, bruising, erythema. There are no piercings, and the umbilicus is midline. And once I have done the inspection, I will go ahead and auscultate. Now, auscultate means I'm just going to use my stethoscope and I'm going to listen here in all 4 quadrants. I'm going to go ahead and start in the lower right quadrant and work my way clockwise. So I'm going to go ahead and begin now, and in ideal situation, she would have her shirt up or gown up so I could be on her bare skin. Starting here, right lower quadrant. And moving up. upper quadrant. Left lower. Very good. There are vowel sounds, all 4 quadrants. And now we're going to go ahead and listen to the your vascular sounds. But this time, once again, I'm going to use my stethoscope. However, I'm going to use this side of the stethoscope. I'm going to listen to some different pulses that you have. You have an aortic pulse, iliac, femoral pulse. I'm going to go ahead and take a listen to those with the bell of the stethoscope. So again, just lay here nicely. I will keep you covered with the blanket. I'm going to start here with your aortic pulse, okay? And moving down in this region. I'm just going to move the blanket. No breweries. Now what I will do next is I'm going to palpate each region, each quadrant of your abdomen. And what that means is that I'm just going to touch you lightly, or actually kind of press on you lightly, but with the pads of my fingers, and I'm going to just go about 1 centimeter deep with this type of motion, like a dipping motion. So again, I'm going to start at the right lower quadrant. Now you tell me if you feel any pain, tenderness, anything at all when I do this. Any pain there?
No.
Now moving up to the right upper. Still okay?
Yes.
And then here on the left. Any pain there?
No.
So there's no pain, no tenderness, no guarding with palpation. So, Aaliyah, that is it for your abdominal assessment. However, before I go, is there any questions or anything I can do for you before I leave?
No.
Okay, so then what I will do is be sure to document everything in your medical record. I'm going to go ahead and give you your call light here, your call bell, so it's within reach. I'll bring all your personal stuff over here, and you can get into a more comfortable position. You don't have to stay lying flat, so I can either raise the head of the bed up, or if you want to just go ahead and sit up, that would be great. You can get comfy. You can just sit this way, however you'd like. Good. All right. Well, thank you so much. I will go ahead and just clean my stuff one more time, and I will be out of your hair here in just a second. Grab this, do last performance of hand hygiene. I'll get all my supplies, and I'll be back to check on you in just a few minutes, okay?
Okay.
All right, well, thank you so much.